All right, we did it. Day 27 of the 27-day mobility challenge here at the Reprogram. We have finished with these essential range of motion tests, these screening tools that you can use to assess whether your joints are functioning effectively, happy, healthy, and doing what they should do, right? Minimizing your risk of injury and minimizing the degree of damage. So what we did yesterday is we did ankle plantar flexion, and today we are on ankle dorsiflexion. And this by far is the most common one of the two in terms of what people lack, all right? And the actual injuries, the symptoms that they bring on are kind of the same. It's just the mechanism slightly different. So in terms of Achilles tendonitis, and calf strains and tears, we're now looking directly at the calf muscle itself. So if we're missing that ability, so if I have my hand-foot model here, and I'm missing the ability to lift the toe up towards the knee, it means I'm missing that ability to actually get enough length through the calves and the Achilles to give me that range of motion necessary, whether it's during walking gait or in a lunge or a squat position. I don't have that range of motion. So of course, if I'm short in those tissues, and let's say I land from a jump and I need to absorb that impact, I land on my toes, the heels need to come down to the floor, my knees need to go over to absorb that landing, but I don't have that tissue length to allow that heel to drop, all the knees to go over, something's going to go, okay, and it's going to be the calf muscle, or worse, the Achilles tendon. So, and if it isn't enough strain to damage those, it will definitely be repetitive movement causing Achilles tendonitis. And we also see that in just people who just walkers and runners, joggers, right? Because if they don't have enough dorsiflexion to allow that, particularly in the toe-off phase at the back, or the stance phase, when the knee wants to come over the foot, the toe, I don't have that length necessary to actually start that toe-off phase and actually get that repulsion of that toe-off phase. So I get excessive loading in the Achilles tendon, okay? So that is those mechanisms. Then I'm also at risk of anterior ankle impingement, particularly if we go to the model of the squat, when I'm trying to access that full depth. If the knee doesn't go over the toe, I'm then either going to fall backwards, or I'm going to try and shift the knee over more forwards, and I'm going to end up the ankle joint won't be able to actually roll and glide posteriorly to clear that tissue at the front in order for the knee to go over the toe, okay? So that's the other mechanism. And then the fourth one would be the shin splints. And that's pretty obvious, because if I don't have that, if I'm running and I don't have the ability to actually absorb force, like I said, if I'm landing on my forefoot, I don't have the ability to actually allow the heel to drop down, I'm going to sort of stay, the anterior tibialis isn't going to be able to shorten effectively ever. So I'm not actually going to absorb that force up the anterior shin as the knee goes over the toe, and that's going to stop me from actually that mechanical process of those antagonistic pairs, the anterior tibialis and the posterior muscles, the calves, from functioning correctly, and it's going to create an overuse in those anterior muscles, creating shin splints. All right, so that is them. And of course, we see a bunch of problems with the patella, the knees, the patella, the popliteal, but we're going to try and keep it focused on the ankles for now. And the test we are going to do is a modified version of the dorsiflexion test, and it's just a heel sit dorsiflexion test, and I'm going to show you that now. All right, so this is the modified version of the ankle dorsiflexion test. Now, traditionally, you go to your physical therapist, he'd have you lie on your back, and he'd grab your feet, and he'd physically push them into dorsiflexion, analyzing whether it's a capsular tightness, a muscular tightness, and obviously trying to get an effective diagnostic from the symptoms you presented in that test. Now, at the Reprogram, we like to modify it, and as you know, when you do it, we like to put you in a position where you can actually get a bit of decent biofeedback, feeling where the restrictions are in that posterior side of the ankle, and feeling where you're tight. You can feel it at the bottom of the foot, you can feel it in the toes, you can feel it in the back of the ankle, the Achilles, or further up the calf, okay? And that's very hard to feel when you're kind of passive on a bed, and some guys just sort of thrusting his weight into your foot, all right, because you don't get that constant tension. So this is what the test looks like. You, just like yesterday's, you're going to have your knees together, all right, and what you're going to do is you're going to basically place your toes on the ground like this. So you're going to basically get the ball of your foot, basically get the ball of your foot on the ground, and you're going to maintain that position whilst dropping the knees down. Then you're going to sit back onto the heels, okay? So a pass would be the ability the ability to keep the ball of your foot or the weight on all your toes completely whilst the knees are on the floor, and that would be a good indication of adequate dorsiflexion. Okay, now a fail would either look like this. They basically can't get the knees down to the floor without the toes coming up, so they'd be on half a toe basically, which is a fail. And also, as they do come down, they just won't, if they do try and keep that ball of the foot on, they just won't be able to get the knee to touch the floor. It just won't happen, okay? It'll be too tight, and they'll be shifting right forward onto the toes again, okay? So that shifting back of the heel, that passive dorsiflexion, where we can maintain our weight on the balls of our foot whilst dropping the knee down, and then adding that extra load of our body weight to see where that tissue restriction is really good, and this is why I really love this screening tool. And also with the ankles as well, you might actually get the point where they just twist the heels out because they can't maintain the ankles together, because that restriction is just stopping them from doing it. As they do come down here, they get to the knees, they can't do it, so the heels turn out again. Again, we want to make sure that the heels are directly under the sit bones, all right? And that is a pass, okay? So just to make sure that that's clear in terms of what's going on with the toes, when I'm doing it, I'm making sure that the toe is completely on the floor as I shift over onto that, okay? So the toes on the floor and the ball of the foot is here, all right? And that is the end of our assessment. Thank you so much for following along. I hope you learnt a lot about yourself. Again, you've now got a better idea of the risks and the injuries you're at risk of getting. You may have a better idea of why you've got an injury in the first place, why you're suffering joint pain, and you have a better idea of what you can do about it. Thank you so much, and if you do like what I've been preaching, follow us, go to www.thereprogramonline.com, and I can really help you. All these assessments and tools are there for free. You can do a movement assessment. It's a complete full body. It then prints out a whole diagnostic sheet of what your direct risks are, what your indirect risks are, causations, and then it creates the program for you so that you can target those initial points that you failed, okay, and then carry on with a more efficient training program that will last you for years to come and keep you feeling mobile, pain-free, etc. Okay? Thank you very much for listening. We'll see you in the next one. Check this out. Hi there, I'm Andrew Graham, founder of the Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine a life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.